Thank you. Well, good morning. How are you? You good? You doing pretty good? Can you hear me? As she said, I'm president and CEO of Feeding America Southwest Virginia, and it's an honor and a privilege to be here today. Our organization, in a now 37th year, my 37th year, is very excited about the opportunity and the recognition that food and the accessibility to food, good food, is a social determinant for health and diseases. And it took us a long time to get there. We knew that by the clients that we see, by the individuals that we interview and our programs serve. And we've known that for a long time, but actually to see that space that's now created for an opportunity for dialogue as well as awareness and partnership is very innovative and important to the work that we all do. I would like to start by one of my quotes that I've tried to live by, and that is, our passion calls us. And I'm pretty sure everyone in this room is passionate about what you do. That's what called you to healthcare. Your calling will keep you when it's hard days ahead, whether it's learning or whether it's serving, or whether it's those clients you see and patients that you struggle as well as they do for their recovery and their good health. And then our purpose directs us. What our purpose is in life and what our purpose is as an organization directs our work, directs our focus, keeps us focused. And then people inspire us. I continue to be inspired by those individuals that we serve, by collaborative partners such as Carilion and the other healthcare partners that we have, and donors. They inspire me, and I'm sure every person in this room has been inspired by someone in your life. Something drove you to take up healthcare as a profession. So I'm going to get started now with our slideshow here. It's got some statistics, but also some photographs. You're going to hear, and you've already heard a lot of data today, right? That's important. That helps us focus on where the need is, helps us know outcomes, and are we obtaining and reaching the outcomes, the desired outcomes we need for people to be healthy, for people to receive services. But it's always about the people. And we always try to remember that when we're talking about the work that we do. And I'm sure you remember that when you talk about the work you do with your patients and a lot of the work you've done in our community and also in practice and clinics and in the hospital. So here in Southwest Virginia alone, for us, Southwest Virginia is 26 counties that border the Allegheny Highlands, West Virginia, Kentucky, and Tennessee, and go as far east as Danville. There are 40,560 children that are food insecure. And to us, food insecurity means that these people or these children lack a consistent access to enough food to lead an active, healthy life. Think about that. Just here in Southwest Virginia, over 40,000 children don't have access to consistent food on a daily basis. I'm going to tell you a story and make that real, because it's always about the people, and this is about the children. One of our employees was at the ER taking his wife, who was sick, and the next bed over, behind the curtain, was a mother and her son. And the doctor came in and diagnosed the problem with the child. And so when the physician left, the child said to his mother, "Mom, I'm hungry. Can we stop somewhere and get something to eat when we leave?" She said, "No, I'm sorry, son. If we do that, I can't buy your medicine. You know that and you see that. That's a reality. And the good news is we can do something about that. In America, I think it's a disgrace to see children go to bed hungry. And you're here today because I believe that you feel that there's an opportunity to help these children. Another story I want to tell you is 2 stories about food that you might and I might take for granted, but our children can't. Our truck driver one day when we were in a meeting was asked, what do you do for the food bank or Feeding America Southwest Virginia? And he said, I drive a truck. And so the facilitator said, no. Tell me when you drove the truck and when it made a difference. And so he thought about it, and he said, oh, I remember a time that our mobile food pantry pulled up to a community, and we opened the door, and we started unloading the food, and there was a little girl there, about 8, and she said, Mommy, Mommy, they have green beans on this truck. We're going to have some green beans tonight. Then another story is one of our children's program was serving breakfast. We have a lot of programs that serve children breakfast during the summer and lunch, and some for dinner. And so this one particular program got a delivery from us, and it was orange juice in that delivery. And this little girl says, oh no, I've never had orange juice before. I mean, think about this. This is Southwest Virginia. I've never had orange juice before. So those kinds of food and the type of food, that nourishment that children need, many of them are not getting. Some have never received it at all. That's our struggle. So food insecure children struggle. They struggle with a lot of things, but specifically here they struggle with learning and productivity. They struggle with mental health problems, chronic diseases, and overweight. And this is what we hear a lot, and one of the things that really ticks me off is when people say they can't be hungry because they're overweight, they overeat. No, they eat the wrong food types. It's feast or famine for some of these families. And so they will have a tendency sometimes to overeat because they haven't eaten in days. And so that balance is extremely important, and that's what you can bring to the table as educators and healthcare professionals. You can bring that to the table to help these individuals understand how to balance food in their lives as well as their medications and the other challenges that they face. So this is what we know, and this gentleman, he pulled out his driver's license so we could see that he was telling the truth. I had an opportunity to work with Pam Fessler from NPR for 3 days. So we brought her to Roanoke, and then we took her to far Southwest Virginia, where people really struggle to put food on their table, and hospitals are closing. Healthcare is sporadic, and many of them do not have insurance. And so food pantry distributions, who worked in the coal mining industry, and in his late 80s is still standing in a food line to get food after he worked all of his life and served his country. So they skip doses of medicine. You know that, right? How many of you really know that your patients or those that you see, you endeavor to help, they skip medication to eat? It's a trade-off for them. It's tough decisions that they make on a daily basis. A lot of times they won't even come for preventive care, and you know that, right? Because by the time you see them, a lot of times these children, they have illnesses that if they could have had preventive care, they wouldn't be so sick. My daughter is in health care. I'm not. I'm in food care, which is now health care, which is really cool. But she struggled when she would see young patients. She was director of OR, and when she saw the children coming into OR and having surgeries, and some seriously terminally ill, that broke her heart. So she moved on to quality. I think she misses patient care, because her passion called her. And so they purchased low-cost diet that it relies on energy-dense, nutrient-poor foods. And we have heard mothers, and we know this, they dilute or ration infant formula. They compromise on how much infant formula they can give their babies because they don't have enough to meet their needs. And then, of course, people make trade-offs all the time. And so this is the real deal, and this is the cost associated with food insecurity and health-related causes. In 2014, because of insecurity, that price tag was $160 billion in this country. And we know that food insecure individuals have an extra cost associated with their medical care because they don't have preventive or health insurance. They can spend up to $1,800 each year, which is $77.5 billion nationally. Now, I think it would be pretty smart for our healthcare industry and for our government to think of ways that we can be more creative and be more preventive so that this price tag is not as costly as what it is today. And there's some steps we can take to help families that struggle to put on their food on the table, but also help lower health care costs for those individuals. And so one of the things that we do at Feeding America Southwest Virginia, and I'm going to tell you a little funny story because I think you need to laugh a little bit. I've worked on Capitol Hill in D.C. and in Richmond on Capitol Hill for 26 years. So I got dressed early one morning, very early, it was dark, and went up to meet our senators and our congressmen. And when I got out of the taxi, I had 2 different colored shoes on. And so I looked down at my feet and realized, oh no, this is not going to work. And so I had my first meeting, and I shared with the staffer for Senator John Warner back in those days, not to look at my feet and not to laugh. And immediately he looked at my feet and he laughed. And you know, public policy and advocacy is extremely important to us. We need all the resources, and it is to you as well, right? You need the resources available to provide the best health care and service that you can to those patients that you serve. And so federally funded programs for children's nutrition, for the school lunch program, for the SNAP program, for the commodities that we get, comes all down through the Farm Bill. And we're currently working on the Farm Bill. We haven't passed one yet. And so it's time for the Farm Bill reauthorization, and it's time for them to pass a bill that would provide all the funding necessary to be able to eliminate food insecurity in our country and specifically in Southwest Virginia. So we're still working on that, so there's still an opportunity for you to contact your senators and your congressman and representatives. So also, as well, we have programs that work on alleviating poverty, economic stability, dietary intake and health, and we'll talk about that shortly. We want to connect as many people as we can to the federal nutrition programs to help improve their health. A lot of resources are available. However, that connection is absolutely important, and the charitable food distribution system cannot do it alone. Partnerships are the only way that we can make that happen. So here's some things that we've been able to do in the healthcare field and with our partnerships. And I will say that our last strategic plan that Feeding America Southwest Virginia did, we purposely included expansion of our healthcare partnerships because we saw those individuals standing in line to get food or at our congregate meal programs, and we could see the health deteriorating. And our research has stated that we have a high percentage of people with diabetes as well as high blood pressure, and it's because of the foods that they're they're able to buy and purchase and they're consuming. Here's what we can do. We can help us all educate people the awareness of what resources are available. We can create a toolkit of local resources to address specific needs of your patients and targeted populations. And we now have a seniors box program that is specifically for seniors and low-income seniors, and we can give them a box of groceries every month at no charge to them. And that program we are currently growing. We have several sites in the Roanoke area, and now we're expanding to Southwest Virginia. That's a new program for us. We just started that program last year, and we're working with LOA and the Meals on Wheels program, so we're supplying those boxes of groceries to those programs as well for seniors. So we're excited about being able to do that. And of course, families with children. And then create new distribution programs in the healthcare facility. There are a lot of food banks across the country and a lot of programs where actually, and we know space is always a challenge at any facility, but there are a lot of clinics and hospitals that actually have a pantry on site there. And when you're screening your patients or when they're being treated and you know that they suffer from food insecurity in their homes or the children, you can provide them with the information for them to go to access food, or you can provide a box of groceries or a bag of groceries to them while they're being treated. And so we've seen a lot of that work increase over the last 2 years across the country. And so that just again is food is medicine, and it provides the opportunity to give them not just prescriptions and medication, but also a prescription of food in order to help them. I know when a lot of people are released from the hospital, a lot of children go home. They go home to empty refrigerators and empty food closets because there's no food in the home. And then there's also opportunities to connect, which we have with our healthcare partners, and we'll talk about that with Carilion, to deliver food on a consistent basis or to partner with us for our mobile food pantry distributions. Some of our mobile food pantry distributions, they serve anywhere between 200 and 500 people per distribution. So we've had a lot of interest recently from a lot of our partners in being able to provide this food. Most recently, we participated in the RAM event, which is a remote area medical event that happens once a year in Southwest Virginia, where thousands of people come to get free health care, and that's the only health care they get for the entire year. We partnered with Aetna. They provided $26,000 to provide 1,500 food boxes for those people that came to get their free medical services. That was a new partnership for us, and it went very well. We also, Carilion, I will say, has been a partner with us since 2004. So I would like for you to know that, and as well, I would like for you to know that over 344 individuals have volunteered at Feeding America Southwest Virginia from Carilion, including any from doctors to students, and that is extremely important to us, the partnership that we have. Funding, providing a partnership to distribute fresh fruits and vegetables with our Veggie Mobile, and some of the work we're doing now with Bradley's Free Clinic, as well as with CHIP, and some of the other partnerships we have. We partnered with Ballard Health down in far Southwest Virginia. They have no accessibility to patients. Down in far Southwest Virginia, the hospital closed in Lee, and so we use our mobile food pantry where there's 200 to 500 people, and they come and they provide services to those individuals as they stand in line and wait for their food. And Virginia Cooperative Extension, we've had a partnership with them for 15 years. They've been providing nutrition education to our partner programs and to the agency clients that they feed for 15 years. And they have done a lot of programs for us. We have 2 housed in our warehouse in Salem and 2 housed in our warehouse in Abingdon. And from those areas, they go out and educate clients on budget and food purchasing, on recipes and better food choices, and they do tastings and provide recipes. So, and we do dental kits and summer food service program for children. So we're going to talk a little bit. This is our service area. We have the poorest counties in the state with the least amount of resources available. So we serve 26 counties and 9 cities in far southwest Virginia. We have our Salem Distribution Center, and then we have our Abington Distribution Center, and still in far southwest Virginia, the unemployment's at 6 and 7%. And so our job, and my job, is always to remind our state, our governor, our representatives, our legislators, that the entire state is not recovered economically. There are no jobs in these communities. The people depend on free services and will until their jobs. And drug addiction is extremely high in those communities. And so we're also partnering with some of our other partners. So in Southwest Virginia, and those 9 counties, those 26 counties and 9 cities, 144,590 people are food insecure. And if you want to go to NPR's site, I'm sure they probably still have the 3 links on there from the stories that Pam Fessler did. And so fighting back together, and I say together because all of our collaborative partners, we do this work together. I want you to understand that through your support, through your help, through Carilion support, we have 350 programs that we provide food to. And those programs distribute, and we distribute enough food to provide over 16 million meals last year, which was around $30 million worth of food that we distributed in the 26 county area. And we did that on a budget of $4.2 million, and that's because we have over 10,000 volunteers. And so we have found a way to stretch a dollar about as far as you can stretch it. And that's through our collaborative partnerships and the great work that everybody does together. But we're moving more into, and this is a picture of the dental clinic from, how many of you have ever been to the RAM event down in far southwest Virginia? So it's just one of those sites and one of those things that you just have to be there to really see the scope of the need in those communities when those people come. I talked to a lady, she had 5 teeth pulled. Now keep in mind, this was July. It was in the 90s. They had camped out to be there for days. She had been through all the other services. She was still walking the fairgrounds, and she had 5 teeth pulled. And so those kinds of services and those opportunities, if you ever get a chance, I promise you, if you ever go once, you want to go back again, right? I mean, because it's just awesome to see how people from all over the country, doctors and nurses and healthcare professionals from all over the country go there to help, because they went once and therefore they keep returning. And so this is the Carilion partnership since 2004. And I will say, when I move on to some of the new work that we're getting ready to do, we are doing, that Carilion was one of the first donors that actually invested in the Community Solutions Center. But this is some of the work that we have done together already. Our additional healthcare partnerships, the Virginia 365 project, was a project led by our previous First Lady, Dorothy McCullough, led the initiative, and we partnered with 10 schools in Southwest Virginia and the DOE through a USDA grant, and we provided children every child in all 10 schools, which were the schools that had the highest childhood insecurity in the state, we're in far southwest Virginia. We partnered with the DOE and all the other state department heads, and we implemented a program where children received 3 meals a day, 365 days a year for 2 years. And included in that project was research for academic, attendance, and behavior to directly connect and to prove that if children have adequate, nutritious food, they can learn better, they behave better, and their attendance is better. And so we're waiting for that report to come out and that research. We all know that, but you know how important, we heard it this morning, research is, and data that we use. And then here's some of our other partnerships that we've had. We've been a partner with the Health Wagon. I understand Rachel is here today. We've been a partner with the Health Wagon for probably 15 years. And they called us when 60 Minutes did that program on them because they wanted us to bring food, to give food boxes out as people were being seen for the free clinic services. We now partner with Bradley Free Clinic, New Horizons, and CHIP, but also we're providing through Carilion's grant and some other funders, the YMCA Diabetes Prevention Program. And that is something we want to expand on and to be able to work. This is some shots from our remote area medical clinic in Wise and the food distribution that we did down there. These are mobile food pantry distributions where people literally stand in line for hours to get food because it's the only food that they have opportunity to get. And then some future partnership ideas, our children's summer health fairs. We got a grant 5 years ago, and we did some summer children health fairs with our mobile food pantries in far southwest Virginia. We feel there's an opportunity through our Cafe to Grow program that we have now in Roanoke, where we actually have a mobile program that takes hot, nutritious meals straight into low-income project areas into Roanoke during the summer. And there's some opportunities there to do some health screenings, do some shots. In fact, we're doing some flu shots with the Health Wagon down in far southwest Virginia through our mobile food pantry program. But there's some opportunity for health education with children. As we feed them during the summer, they have to stay there and consume their meal. There's a silly regulation by USDA that says that they will not reimburse us unless we watch the child consume their meal. So when it's 99 degrees in Tinker Creek Apartments or Ashton Heights, those children have to sit in that sun and consume their meal in order for us to be reimbursed. Isn't that stupid? And that's all tied up as well into Farm Bill and Child Reauthorization Act. So we need your help to help us change some of those requirements. And then education for home health care workers. This is something that, and by the way, Steve Arner is on our board of directors. And Steve Arner has been bringing volunteers to Feeding America Southwest Virginia for 15 years, back when we were on Shenandoah Avenue. He's always been involved in directly volunteering and bringing teams. Now he seems to be a little busy. But, we've had several teams come in from Carilion and volunteer, as I said previously, at our center. But we believe there's a great opportunity to educate home health care workers, because they go into the home, and I know they know when they go into that home if that family has food or not to feed the children. And if the family does not, there's an opportunity to equip the home health care workers with a list of agencies where the family can go get food, a list of programs that are accessible to them. So we know there's a great opportunity there that we have not been able to implement quite yet, but we are working on that. And then providing information to our food distribution programs about children's health clinics and other opportunities that they could participate in if they knew about it. This is a new partnership that I was speaking about when we were presented the opportunity by the Roanoke City Police Department, came to us, and they wanted to repurpose the highest crime property in the city of Roanoke. This property was the highest crime property in the city of Roanoke. The police department had shut it down 3 times because they kept having shootings and stabbings, and the captain of the police department had worked that community for 20 years, and he made a personal, our passion calls us, right, but our purpose directs us. He had decided he would not allow that property to reopen again. So he started looking for organizations that would be interested in repurposing that property. And he worked with 13 organizations or pastors or people that worked in the Northwest community. He had been meeting with them for 6 months, and he had 13 of those representatives. And then he came into my office one day and asked me if we would consider participating. Would we facilitate the conversation, take a lead in it, and did we think we could repurpose this property? And so, and the property today, if you've seen it, if you haven't seen it, you need to drive by on Melrose and take a look at it. Before, it was absolutely a dump. And so, however, he asked us to consider that. So in our strategic plan, that's why planning's important, we want to establish new partnerships to promote self-sufficiency for the clients that we feed. We want them to have gainful employment so that they can feed their own families, so that their children can be healthy and their families can be healthy. And so we have wanted a community kitchen for a long time because we wanted to provide our children's programs with healthy, hot, nutritious meals. And so that's why we launched the Foodie Truck for Children, which rolls into communities in the after-school programs as well as in the summer and the communities. And so we turned this property into a workforce development training kitchen for the entry level of culinary arts. And then cohorts get soft training in workforce development, interview preparation, and other types of support services. And at the same time, we have in this facility a safe place for the Roanoke City Police Department to work with individuals in that community. And the project they're working on now is reducing gun violence and Northwest community. And so they're putting together a committee and a group of citizens in that community. And then the other group working in that community is to end hunger in Northwest community. And eventually we will have a small fresh foods market in that facility, and it just will be small and fresh foods only, and because we get a lot of product in, and because we have some opportunity to work with some of our other partners to provide some fruits and vegetables in that community. I will say crime has been reduced 71% within a certain radius of that property, which has been really cool to see. Our first summer, we opened in May. Through August, that facility cranked out over 19,000 hot, nutritious meals for children through volunteers and through our students in the program. And so this is that's our Cafe to Grow. How many of you have seen the Cafe to Grow? Have you seen our Cafe to Grow, our foodie truck for children? It's what we wanted to do, and what we found out was if you give children the power of choice, they're more than likely going to eat what they choose. If you hand them something they'll probably eat part of it and throw the rest away. So I wanted children to have a choice. I wanted them to walk up to this foodie truck, and I wanted for them to say, what do you have on the foodie truck today? And for them to have an option of one of two meals. And so we have Taco Tuesday, hands down, is their favorite. But, you know, we have the salads, chef salads. We have meatball subs. And so anyway, so what we do is we cook the majority of the ingredients in our kitchen, and then we load it onto our 18-foot concession trailer, and then we put all the ingredients and the meal together on site, and then we distribute it. And we have a lot of partnerships with a lot of corporations in the community that actually go on the truck. It takes 3 to 5 volunteers for each distribution to work with those children for the after-school programs, as well as for the summer feeding sites. And then these are some of our students that are in the culinary arts program. And again, Carilion made one of the first initial investments in this property. We had 90 days to raise $850,000. And we didn't have the resources to enter into this project, but we knew that it was absolutely necessary. And so we started making some phone calls. And of the first 3 donors, Carilion was one of the first 3 donors to invest in this project. And we were able to, Roanoke City gave $500,000 of CDBG funding. They had a problem, right? And they wanted to solve it, and so they had some CDBG funding. Food Line, never in their history, ever, had given us this kind of money, and we called and asked for $350,000. Didn't have any idea they'd say yes, but our job is to ask. And they called us back in a couple weeks, and they made a $350,000 gift. They have invested in this facility, and they are very proud of the work that is happening. One of our students has already gotten a job at a local hospital, and one of the other students runs a vegan business, and she wanted to learn the skills of culinary arts. She had the Save Surf Manager certificate, but she wanted to learn the skills of culinary arts. And so it's been cool to see the transformation. We're in our 2nd class of students. We had 4 graduates, and we're working with Virginia Western because if any of our graduates wants to go into a more advanced culinary arts program, we're partnering with Virginia Western to be able to provide an opportunity for some of them to be able to do that. And again, these people will be able to feed their own families, and they won't have to depend on charitable food distribution. Their children will be healthier in the future because of it. So how are we doing on time here? Okay, so Q&A? Do you have, it's a lot of information. I tried to take some of the data and make it a little more personal, but now's a good time for questions, if anyone has any questions. Yes.
Thank you so much for your presentation. Where does your food come from? Is it locally in this area, Midwest?
That's a good question. Our food comes from all over the country. Feeding America Southwest Virginia is a partner. We're like a network partner with Feeding America National. But what a lot of people don't understand is we're an independent nonprofit organization here locally in Roanoke. Our resources, our support, we have a board of directors, but Feeding America National solicits national manufacturers and corporations. So we get sometimes quality control rejects. We get production items through national resources, Kellogg's, Quaker, and then we also get food through USDA. I don't know if you saw, but there was about $50 billion in the president's budget for commodities, and so we'll be getting some of those commodities. Unfortunately, there was no funding to distribute those commodities. So, and it costs about 20-some cents a pound to distribute food. But so some of the food comes from that. We get food from local farmers. For the last couple years, we have made a financial commitment with a local cabbage grower in Hillsville. And he grows cabbage for all the food banks in the state of Virginia. And so we get corn from a large farm and down in that area as well. So we work with farmers, retailers, all the retailers in our service area, from Kroger, Food Line, Walmart, Sam's, BJ's, they all donate. We also get food from all the Darton food groups, Olive Garden. We get a lot of fresh food that way that we moved through to our on-site feeding programs. We have a lot of companies. Carilion has for many years done food drives for us. So we have the Letter Carriers food drive and other food drives. And we get venison from Hunters from the Hungry. So just about anywhere that you can find food, we work it to the 10th degree. But anyway, it's never enough food, unfortunately, but it does come from all around the country, and it comes from local resources as well. Thank you for that question, because it's real important, and I did fail to mention that, so thank you. Mm-hmm. Yes. 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 There's a great opportunity there. Yes. 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 You're welcome. Thank you. Saw somebody's hand over here. Did I see somebody else's? We appreciate all that you do. You know, it's a partnership, right? And it's evolving, even as we speak. We're social entrepreneurs. We feel we ought to be relevant to our communities that we serve and to the people that need the services, as well as our donors and our corporate partners. And so what we're finding working with healthcare, just as you were saying, is that we no longer go in with canned presentations. We go in to sit around a table to talk about collaborative opportunities and innovation. And how can we do things differently than we've done them before? And how can we be innovative yet relevant to the point that we're serving the needs of the donors, of healthcare industry, but of the clients that we serve, and certainly of children. I don't want to see another child go to bed hungry tonight. And I'm sure you don't want to either, right? You know, my son dated a young lady that had 4 children. And he said, Mom, and she was a single mom, he said, you've never experienced something until you've heard children cry at night for something to eat. And he said, and then the mom has to say, we have nothing. You know, and in America, that's a disgrace. People waste enough food to feed all the children. Yes, ma'am.
Just a little insight into the rule about having to watch them eat food. I was working in the school system in Irvine County, and school bus driver made a comment once that he recommended the child for eating on the bus. On a Friday afternoon, we provided the book bag, and he recommended the child, and the child said that he had to eat the food on the bus because when he got home, the parents would eat it.
And that's true, and that is a good point. And we had a hard time with children in some of these low-income areas wanting to take their food back to their apartments, and we had to say, you can't do it. It is. And siblings, that's the other thing, too, we hear, is that siblings you know, if your child takes some food home, then a sibling wants to know where their food is, and they have to share it. And we hear that all the time. And the school systems, don't you think there was a lot of difference in the way the schools are looking now at feeding children, and now after school, the meals? I know it's more difficult, it costs more, it's more labor involved, but man, we sure have seen a lot of schools step up to the table, DOE, and say, we don't want our children hungry. And I think that's exciting, what is happening in the school, in the DOE and the Commonwealth.
And I've also heard we have a youth group that works with the food, providing food in the summer program in theirs.
Yes.
And apparently, like, Governor came.
Uh-huh.
It's the largest, I mean, they support so many people. I don't know what the numbers are, but it's the largest actively used school in the district.
Yeah. Yeah. And that's a good point, because you're catching them where the children are, right? That's why I'm talking about health care. If your patients are there and you know they need food, if you have space, to have a small pantry on site would just be absolutely awesome. Because, you know, we have to give referrals all the time to clients to go different places, get their food, and then they want to know how they're going to get there. Transportation costs, right? And so we're finding there's so many different models out there, but I promise you that if there's a model and your passion is calling you and your purpose is directing you, you will inspire us to work with you so that we can serve more children and they can go to bed with something to eat. Not just something, but the right thing to eat. Yes, sir.
On a slightly related note, with regards to clean water in Southwest Virginia, does the majority of Southwest Virginia have access to potable water? Is there a shortage of that as well?
Well, there's a lot of wells in Southwest Virginia, and, you know, when they have well problems, then the homes don't have. You know, there's a lot of things we can take for granted in a lot of different areas, you know, and one is cutting a spigot on, right? And so not every family gets to cut a spigot on. So there are some, you know, problems with water, just period, drinking water in Southwest Virginia. I got in trouble one time for saying that Southwest Virginia was like a third world country. And someone didn't give me time to explain what I meant when I told Pam Fessler that. And then it came out in the Delta magazine last year under the giving section. Third world country for us. And when I say that, I mean there's more needs in Southwest Virginia than resources to solve the problems. And that's what I mean when I say that, is the resources. But there are problems with drinking water in Southwest Virginia for a lot of families. There are some grants to get wells, you know, repaired, but they're very few. And so, yes. 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 Yeah.
And then they didn't have transport to get home. So I just went, oh my gosh, was this, you know, entire trip just to be able to get food? I often got that feeling, and I'm thinking to myself, there needs to be more awareness, because honestly, it kind of drives me nuts when, you know, famine, starvation, hunger, and so these kids in India and Africa, we have a problem right here.
Yes.
And I feel like it's like, you know, there needs to be more awareness. The hunger, the famine, it's a disgrace for kids to be starving in America. It's a disgrace for kids to be starving
Anywhere. That's right. That's correct. And I thank you for saying that, because, you know, it's real. The struggle's real, you know, and I thank you for coming over here and working in Southwest Virginia, you know, because there's a great need there. And I want to thank all of you for the work that you do to keep our families and our children healthy and safe, you know, and I know that you see a lot of situations that probably trouble you, but the next time you do and you realize that someone's hungry, please let us know, and let's think about ways that we can work together to make the people in Southwest Virginia more food insecure, but also healthier. I love the new term social determinants. You know, and that is the different things that cause people to be unhealthy, right? And food